Welcome back to the Best Docs Network. In the studio, we're pleased to be joined today by Dr. Harvey Carter, owner and founder of Carter Eye Center and one of the top cataract surgeons, not only in the Dallas-Fort Worth area, but in the country. Dr. Carter, thanks for being with us today.
Thank you for having me.
Now, you were the first doctor in the United States to perform the Crystalline procedure once it was approved by the FDA. Can you talk us through the procedure and how it works?
The Crystalline procedure is where you do a cataract implant operation, and cataract implant surgery is done with an implant lens where we replace the cataractus cloudy lens in the human eye with this implant lens. The Crystalline allows the patient to develop a wider range of vision after surgery because the lens is the only lens approved by the FDA to accommodate or focus in the human eye, which gives you the widest range of vision from near, far, intermediate in terms of a range of vision, allowing the patient to get some degree of spectacle freedom.
At what age do you normally see cataracts forming?
I'd say roughly 2 out of every 3 patients over the age of 60 have some degree of cataract development in their eye. The average age of the roughly 3.5 million or so patients who had surgery in the United States last year was probably around 72 years of age. So it's a painless, progressive, gradual loss of vision over about a decade or so is when patients start to notice it. The first signs and symptoms will be things like glare, halo, difficulty night driving, inability to see the television, different activities of daily living that'll just start to become impaired as you get into your 50s, 60s, 70s.
And what exactly is the definition of a cataract?
Cataract is when the lens in the eye starts to become cloudy. Okay, the word cataract comes from the old Greek word cataract, which is running water or a waterfall. Such that still water is clear and transparent, you can see through it. Running water or a waterfall, the cataract from the old Greek, is cloudy, so you can't see through it. And that was where the name came from. So the process of a dysfunctional lens going to a cataract begins in your 40s. So you're going along, and let's say you're spectacle free until age 40-something, and then there's that dreadful day when you can't see the menu or something here, and you push it out, you go, oh, okay, and then you go, oh God, you know, because it's a time-related, age-related thing. So at age 40, that lens in your eye starts to become dysfunctional, and you lose this. Well, fast forward to age 50. Age 50, this is gone, okay, and now your iPhone, your cell phone, your computer terminal starts to get blurry. But you're not done, okay? So at age 60, fast forward again, you know, this is gone, now this is gone, now that starts to go. And it's just one of those things where it just goes from this dysfunctional lens to a cataractus lens, and then the cataractus lens gets blurrier over time, and you finally end up having surgery just at your discretion whenever it starts to interfere with your vision.
Now, in regards to the Crystalline surgery, how invasive is it?
Cataract or Crystalline implant surgery today is remarkably easy on the patient. If you take and rewind 50 years ago, to do cataract implant surgery required the patient to be put to sleep, general anesthesia, hospitalized for a week with sandbags on the side of their head. Fast forward to today, and the operation is done with eye drop anesthesia. Okay, so you're not put to sleep, no shots, no needles around the eye. The surgical procedure is brief, just really a few minutes in the operating room, even though you're at the surgery center for much longer than that. And the recovery is usually very, very quick and uneventful, with the patient using eye drop, the same eye drop type medications as we use in the anesthesia in terms of eye drop form. So a lot easier on the patient than it has been before.
And do I understand correctly that you don't necessarily have to have a cataract to be a candidate?
Well, that is true. If you take and look at the operation, cataract implant surgery, which is where this came from, involved taking the cataract out and putting in this monofocal lens implant. And that's the most popular #1 procedure performed in the Medicare age group. When patients started to realize that with these new lifestyle lens technologies which could reduce or eliminate their need for glasses and reduce or eliminate their spectacle dependence, you've had patients starting to pay out of their own pocket for dysfunctional lens surgery, where they do the Crystalline probably at an average age of something in their early 50s. whereas the cataract patient is having the crystalline procedure maybe at an average age in their early 70s. So we've seen a huge number of patients who are choosing, in terms of a lifestyle choice, to have this dysfunctional lens removed before it's a cataract and have one of these lifestyle lens implants put in, like the crystallines.
Thank you so much, Dr. Carter. We're thrilled to have you a part of the Best Docs Network, and we appreciate you sharing your knowledge with us today. And for more information on Dr. Carter, you can visit our website, bestdocsnetwork.com, and click on his profile page.